Nice. Sure, it's going cool. Okay, sweet. Yeah, so this would be a good way to go over this stuff. I mean, really starting from the beginning here. The hip is a really nice place to start because there's a lot of big muscles and big attachment sites. This is how I started. When I learned this stuff, they started with the hip.
Right.
Imagine like going
all the
into nitty gritty. There's a lot of articulation
Yeah.
happening. So this is like, oh, the thing does this, it does this, it does this, it does this. So,
right.
Yep. So the exploring the skin and fascia, the skin stuff is cool, but really what we want to know is bones, where stuff attaches, where stuff moves and actuates from. So, yeah, we have all these bony landmarks in the pelvis, sacroiliac joint, which is the thing that people always complain about pain. I have SI joint pain, right? The sacrum is this big slab at the end of the lumbar spine.
I know the sacrum because of like yoga.
Yep. Coccyx is this little fake tailbone we have right here.
Is it the tailbone or?
Yes.
Oh, okay.
Yeah.
So then
Like
I know.
fake
Yeah.
tail. It's
yeah.
not. It's
okay.
our little tail that we ended
I
up
just always call it
evolving.
the tailbone.
It is. Yeah. It's the thing that evolved out of us
Okay.
when we didn't have
Right.
you know
Okay.
a tail.
Yep.
anymore.
Okay. So then I know exactly where that is, and so that's easy to know because the tailbone, the sacrum's just above it. Then.
Yep. You got it.
Okay.
Yep. And then the thing that attaches to the sacrum is the
is it this? Oh, the ilium.
Yep.
Yeah, the ilium.
big old
Ilium.
hugging pelvis, whatever you want to call it. But this is the whole pelvis thing.
Okay. I know. Zoom in.
So then we have this guy, which is the
I don't know how to say
this
some of these.
no
The pubis?
this yep pubis, yep
Pubis? Okay.
yep, and then this thing
Is that one? How do
yep
you say that?
it's called the ischium, or people call it the
Ischium.
ischium. I
God,
think
there's so many. I'm like,
yeah, ischium is an easy way for me to ischium. Yeah, so a lot of hip flexors attach here. The hamstrings attach to the ischium,
and that would be the muscle part to this.
Yes, it's the sit bone. The hamstrings are the muscles
Right.
that attach to
that.
The,
Okay.
Yep, to the ischium.
That makes sense.
Yep,
Okay.
and you can kind of, if you like, put your finger like under your gluteal fold.
Where?
Yeah, like right there.
Yeah.
Now bend your knee. Sorry, pull your heel towards your butt.
Oh.
Yep, pull your heel up to the ceiling
Up?
towards your butt. There you go. Yeah, all the way up. And then down.
Okay.
So put your finger right there.
Okay.
You can feel
Oh, the muscle?
the hamstring moving.
Right.
Oh,
Okay. So that's part of your hamstring?
Yes.
Oh, interesting.
Isn't that crazy?
I thought it was just down here.
All right.
Huh.
So
it's got to attach to something.
You got it.
Yeah.
You got
so.
it. So now that we know the hamstring attaches to the ischium, the hamstring attaches to whatever the heck's going down here that we'll learn in a bit here. Now we know that the hamstring can do a few different things to the body.
Right, because it's going to control up here, but if it comes all the way down here.
It's doing both. So
Then
it's
it's
a
doing
knee. So what is it doing to the knee?
Flexion?
Yeah.
Knee flexion?
And what plane?
Sagittal?
Fuck yeah.
Okay.
Yeah, that's awesome, right? So that's the way to think about it, right?
Right.
Also, it attaches here.
Yeah, that makes sense. Like when you do a bootstrap and you like you lengthen your thing, this whole thing tightens.
Yep.
Compared to like if you have it up.
Yep. Exactly.
Interesting.
It is. It totally is, right?
Okay.
So, what we're seeing is like, okay, if someone's having a knee flexion issue, well, then maybe we can be thinking, oh, maybe they have a hamstring control issue.
So that just basically means if they're trying to extend their
No, if they're having trouble bending their knee,
bending it.
then
Right.
maybe that there's an issue generating tension.
Would it have to do with the quad at all too? Because doesn't the quad kind of come down in that like?
It could.
Region?
Yeah, it could. It could. There could be some quad dysfunction as well.
Okay.
Yep. Like potentially, there could be a hip flexion issue.
Right.
Right. So that's getting into the nitty gritties, right?
Yeah.
Of the tree. But this is
Right,
great stuff to talk about. Like if someone's like, yeah, it sucks doing this.
Right.
Like every time I do this, it like, gives me this weird thing.
Up here.
Well, what I start thinking about is the mechanics of it, right?
Right.
Is it that they can't do this? Or is it that they can't do this?
Right.
Because they're going, I don't like doing this.
Yeah.
So then what I would do is I would break it down when I'm assessing somebody and go, can you do this? And they're like, well, yeah, that's easy.
Right.
Okay, cool. Well, can you do this? Well, yeah, that's pretty easy. Okay, well, can you do this? Oh, oh, I don't like that. Oh, you don't like doing this.
So
okay, why don't you like doing this? So this could be like the hamstring not wanting to do this. Right. So that now you're thinking about where muscles cross joints and how they actuate joints. So, then we're going down the rabbit hole here, which is cool. No, this is good stuff, right? Because then what we're thinking is, okay, now my theory is, okay, this guy has plenty of hip flexion. Right. But he hates doing this. So he doesn't like knee flexing. Okay. Well, does he like knee flexing when his foot is like this?
Right.
Oh, he likes that. Okay, so you like it when your calf is shortened.
Right.
But you don't really like to do it when your calf is lengthened. Okay, so maybe this is a calf thing, not a hamstring thing. Right, so you can kind of work into diagnosing a mechanical issue by understanding the functional anatomy and the way that the muscles control the joint system. Yeah. And so that's kind of how you navigate theory there. Right. And or hypotheses. Yeah. The thing about this is we are in the end not looking at individual muscles. We're looking at sets of muscles controlling joints. So this is helpful for understanding the nitty-gritties. But in the end, what I'm looking at is this guy doesn't want to do this. And he likes to do it like this. But not like this. And what do I do about that? Right. Right. And so it's not like, medial gastroc is controlling the ankle, and therefore the medial gastroc is the thing that's hindering knee flexion through the hamstring. It's like that's too. We don't need to get that deep for the most part of people. I want you to understand that it's not as scary as it looks when we start looking at this gross.
It's movement. One of those things where it's a lot, but it all kind of falls into place.
Exactly. So. Totally. Cool. Yeah, so bony landmarks, this is going to give us a really, really nice pathway to understanding what muscles are moving where. Okay. Do you want me to go over all this with you right now?
Yeah, whatever you want to go over. I'm learning a lot.
Well, okay, cool. Yeah, we can, then we have the, let's see here. Then we have the femur, obviously, which attaches into the
hip?
Yeah, sure. Pelvis, right?
Pelvis.
Yep. And this is called the femoral head running into this thing here is called your acetabulum. The acetabulum
is just the hole that it's gonna
fit in? You call it the hip socket too.
Hip socket. I've heard that.
Yeah. So
I've heard a hip socket.
Either of those things are absolutely fine to call it.
Okay.
So we know that there's a lot of the leg is important the pelvis is important for stabilizing the leg, right? So that's like a huge component of this. I'm going to charge this for So very, very important to understand that if we are having hip control issues, then we can potentially say that, okay, maybe maybe the pelvis is unstable, which is then impacting our ability to use our hip or control it. We see that a lot of time with squats, right? The pelvis is unstable. Someone's having trouble squatting.
Yeah, or you have the anterior pelvic tilt, which makes it really hard to squat.
Right. And so, what is contributing or causing the anterior pelvic tilt. And then you go down that
right.
road too.
Yep.
And that's that's what people are paying us to do, is troubleshoot these things, right? So bring this thing up. Make sure this is still recording. Oh yeah. Are we charging? Yes, we are. Okay. Very good. We're in it. It's fantastic. Yeah, nice. Okay. Figuring this stuff out as we go here.
Yeah. Trial and error.
Yep. Cool. So we have lumbar vertebrae running into the pelvis. This is just reinforcing stuff over and over again. Pubic crest right here. We have the
was that this?
Yep, exactly.
Okay.
Yep.
Okay.
This is why it's so nice to have the
skeleton,
right?
Yeah.
So this guy right here
is the
you can look down here. You don't have to.
It's the
iliac crest.
Crest.
And then this is where
the fascia. Yeah. So that's like the inside of it.
Yep. It's where all this psoas-y tissue attaches. These guys, these bony landmarks. Yep. A-S-I-S and A-I-I-S. So, yeah, right?
Yeah.
But the thing about it is, you think about
anterior, superior, and interior, inferior.
Yeah, right. So, superior.
One's above and one's below.
Inferior, right? So, when you break it down, it makes more sense.
Yeah,
right?
Totally. Once I saw that, I go, oh, yeah.
So, yeah, we go ASIS, and when we're palpating this thing, and it is important to know where this is, because when we're doing a leg length measurement, this is where we measure from right here into this guy down here, which is called the malleolus.
Okay.
We'll talk about that later.
Yeah.
Sacrum, good, check. Lesser trochanter, we were just talking about that, right? This guy, where that psoas runs in. Greater trochanter, this big old honk of meat, or this big old honk of bone right here.
So what was the other one? Oh, so the greater is the outside one?
Yep.
And this is the lesser?
Yep, you got it. Yep. What's this?
Femur.
This. Condyles. We obviously, this is this condylar area here.
Okay.
We need to know that this is the thing that helps the knee articulate. And then you get into the nitty gritties of it here. So it's kind of cool. They like satellite zoom in. Yep. And then you can go here and you can kind of quiz yourself and go, okay, iliac crest, iliac fossa, ASIS, AIIS. You want to cover that,
right,
or whatever. Go down the row there. Superior ramus of the pubis is this region here. This is the ramus of the pubis.
Okay.
This is the pubic ridge, pubic symphysis, and then the ramus is there. Right here, actually. Sorry. Yeah, that's the ramus of the pubis.
So is this?
That's
this?
It's a side view.
What's this whole
This guy right here. So it's like if you were looking at it like this.
Got you.
Yeah.
I see.
Yeah.
I see, because then that's where the little socket is, right?
Nope.
No.
This is where the socket is, right?
This is where the socket is?
Alexa, stop the timer. No. This
is where the socket is? No. Because that would be on the opposite side. This comes in first.
Oh, we're looking, you know what this is? This is
what
looking medial.
Inside?
That's what
Inside?
it is. Yep.
Okay.
This is looking outside. I'm sorry.
Oh, okay. That makes more sense. That's where the socket is, right? Right here? This sort?
Medial view of the hip.
Okay.
So looking at it like that.
That makes sense.
Versus lateral view. Looking at it like that. There we go. Yeah. Oh,
I'm like, what are we looking at?
Check it out. And it shows that section cut there.
Okay.
Yep.
I see.
Yep.
Okay.
Nice.
I was just getting a little confused.
No,
I'm like, wait a minute, what is that?
Yep.
Okay.
Cool.
Okay.
Yep. So like, I mean, the funny thing is, by the time you're done with this, you're probably gonna know more about boning landmarks than me at this point.
Well, I mean, that's fine with me.
No,
I'll
it's
take
good,
it.
right?
I'll take it.
I did this 13 years ago.
I've never
12,
nailed this
10.
much stuff in my life, so I'm
It's
like
cool, man.
100% on it.
Yeah. Head of the femur that goes into the acetabulum.
Mhm.
That's the thing that moves around.
I already don't know a bunch, but when I talk to certain people, I'm like, oh, I actually kind of do know some stuff,
yeah, for sure.
And they just kind of look at me and I'm like, oh.
Yep. Okay. So yeah, so getting to know this stuff roughly and generally is the ticket.
Okay.
This is the palpation journal where you can this is going right. Oh, there's right back here. And
the feeling of the muscles, I can't get that down.
It's okay,
I don't understand that.
Worry more about the bone
Okay,
than the muscles.
alright.
Yeah. Like when I'm looking, it's like for example, if I'm doing a postural assessment, and I'll just show you so I'm looking at your ilium, right? So I'm going, this is the top of your iliac crest.
Okay, that's this?
Yep, you got it.
Okay.
And when I'm looking at that, and when I'm trying to determine if you have a pelvic hip hike in certain directions, I'm going, okay, here's her PSIS, here's her ilium, here's the iliac crest, and then I'm looking and I'm going, okay, they're the same height. Good, moving on. Right, that's kind of what I'm doing there. Or like if I'm looking at a shoulder blade, I'm going, okay, this is the medial border of the scapula. Here's the spinous processes of the thoracic vertebrae. Okay, they look like they're about that far away. These guys look like they're about that far away. Okay. Feel pretty close, right? Like that kind of thing.
But are we ever in a time where we have to feel muscles and know which way they're going?
No.
Oh, okay.
That's what I'm saying. Don't go
okay.
there. Yeah.
Because I was like, I can't feel anything.
No, that's the thing is
Okay.
we're looking at what's controlling.
Right.
The muscles are controlling the bones. The bones are going to give us an idea of why the muscles are doing what they're doing. So, for example, if you're feeling my scapulas, the medial border, one of them's like this, and you're like, what the heck? Why is this person's scapula so close to the spine over here and not over here?
Right.
Well, I'm gonna write that down.
Right.
Because we're going, why is their brain doing this?
Yeah.
Why is this happening? Right. You're never really gonna need to be like, oh, these rhomboid muscles run medial lateral and retract the thing this way. I mean, it's helpful to know that stuff.
For sure.
But mainly understanding gross joint
Yeah,
motion.
yeah.
Totally. Yeah, you never have to
Because I was doing it on myself. I'm like, I don't feel any direction. I just feel
the straight
something.
Don't.
They're like, it either runs this way or this way, and touch and feel, and I'm like, I feel nothing.
It is good to know
which way they run.
Right.
Yeah.
Like a pec. You need to know that a pec does this.
Yeah.
Especially if you're training somebody and you're like, hey, I need you to squeeze this stuff and do this.
Right. Yeah.
Because you know if for example, if you thought these muscles did this, then you'd be like, retract your shoulder blade.
Yeah.
And the person would be like, what are you talking about, right? So
that makes sense.
there are times when
and the bicep running
we
down
know it
because
needs
we
to
can
But then when you get this when we go I think I just slapped that one in there. When you go here, this is when you really start understanding this muscle doesn't do this.
No,
there's no way it does.
Hence why we're running the cord up and down. Yeah.
Exactly.
Okay, I understand.
Yeah. So that kind of all that's what I love about learning it this way.
Yeah.
Is because you go, this is a pelvis, this is an ASIS, this is an epicondyle, this is a tibial epicondyle. This thing does this.
Yeah, no, and it actually makes a lot of sense, but I think that's also because I'm so visual and tactile, so that makes a lot of sense.
And it's nice because we can be visual, tactile, kinesthetic,
see the words,
learn,
hear the
yeah,
words,
it's like, oh, you
read the
get
words.
this like
yeah.
cornucopia
Yeah.
of information. It's like this delicious dinner of like mechanics and anatomy and everything. So
I'm for it.
yeah, man.
You haven't lost me.
No, good. Yeah, I love this. Is so it's always super cool to come back to this stuff.
Yeah.
So yeah, this is just getting to understand the land markings and everything here, which will then get us back to the muscles.
Okay.
Yeah, and then we can go through. I do like to personally. I like to compartmentalize the joint actions to muscles.
Right.
And then if we, what's nice is that we can go here and then go. Okay, quadricep femoris group. Good. We can look at that in more detail. There we go. Yeah, that's how we'll do this. Actually, this is how I think we should do this. Is you get the general. I love how they do like they got a general gist.
Yeah.
And then they're like, okay, let's deep dive.
Yeah.
Here's the stuff.
Yeah.
Let's deep dive.
Yeah.
Here's the stuff. Pelvic floor. This is super important stuff to know. We'll talk about this too. I'll talk about it later. And then just going through this stuff. So sartorius was the next one. Was that a helpful kind of idea? Okay. So yeah, I think the thing the now that I'm looking at this, the big thing to get through would be probably to page 299.
Okay.
That's what I'm thinking.
Yeah,
then,
you just give me the assignment.
Yeah. Well, yeah, I'm looking at this because once you get this, the meat and potatoes, and like you kind of know the muscles, and if you want to go further, you can, but you just get kind of a general sense of the muscles, and then when you come in here, we can be like, okay, boom, 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 boom.
Right.
So as major, cool. Hip flexor, what is this? Quad fem, glute, no. Psoas, where you at? Vastus, these are quads. Gluteals, we can find it, go through, there we go, iliac, psoas major, okay. There it is. Vertebrae, origin, bodies of the transverse process of the lumbar vertebrae. Insertion, lesser trochanter, action, flexes the hip, may laterally rotate the hip, so may externally rotate a teeny bit. With the insertion flexed, it'll flex the trunk towards the thigh, right?
Yep.
Tilt the pelvis anteriorly.
Right.
So if you have a tight hip flexor or tight psoas, it might do that.
Yeah.
Right?
Yeah.
So that's how we can do this, and then we can go, okay, boom,
Right.
there we go. Right.
Okay.
Okay, good. So, this is what you'll crush through this week.
Okay.
I do want to spend a little bit of time